It's now time for your health show. My name is Purity Museo. A very warm welcome. Overweight and obesity are defined as abnormal or excessive fat accumulation that presents a risk to the health. A body mass index, popularly known as BMI, over 25 is considered overweight and over 30 is obese. This is according to data from the World Health Organization. The issue has grown to epidemic proportions with over 4 million people dying each year as a result of being overweight or obese. That was by 2017, according to the Global Burden of Disease. Rates of overweight and obesity continue to grow, not just in Africa, but globally among adults and children. From 1975 all the way to 2016, the prevalence of overweight or obese, especially in children and adolescents aged between 5 and 19 years, increased more than fourfolds, from 4% to 18% globally. And why is this so? Today, to help us unpack this topic is Dr. Yubrine Moraa, a consultant physician, and I'll also come back, Dr., and ask you, why is this so? We are seeing reports, data indicating that obesity among children, adolescents is on the rise. Yeah.
Wow, that's it's a very emotive and emotional thing for me when you think about the rise and the epidemic of obesity that we are witnessing in Africa, where we used to have malnutrition. But you know, malnutrition used to just be associated with emaciation. But now malnutrition is also being associated with overweight. It's also a form of malnutrition because it means you're feeding on the wrong things, you're feeding your children on the wrong thing, and you're putting their health at risk. So now, keeping in mind how in the cardiovascular world, we are very concerned about the rise of cardiovascular diseases and associated illnesses, including diabetes, high blood pressure, kidney disease, and rise of other things like respiratory illnesses and issues of cancers that are associated with obesity. We wonder, and we keep on asking ourselves as African scientists, where did we miss this shift?
Exactly.
What is going on with our society, and what are we not doing right, really? But now that brings me to your question, and I'll go back to say that most of these things we are seeing, they're starting preconception. Why our children are obese starts from even before the mother gets pregnant. So how are mothers getting ready for pregnancy? Yeah. So most likely a mother who is obese will have a child who is obese, biologically and socially. So we are not getting ourselves ready as women to be in the right body frame physiologically to conceive. So when we conceive, we end up with things like high blood pressure in pregnancy, typically associated with being overweight and eating the wrong things during the pregnancy. And that blood pressure in pregnancy gives us a restricted intrauterine growth, really associated with high blood pressure during pregnancy. So we get kids who are prematures or who are small for age. Those kids, and data has shown that those kids are more at risk of being obese. So there's a lot of theories that have been put forth, including the thrift theory about how someone who is small for age or had intrauterine growth restriction the body kind of tends to protective mode. So it is almost trained to store for starvation, so to speak, in a very simple word. So trained to store for starvation. So every time that kid will be feeding, and as I said, the mother who is obese will most likely feed the child that they have obese, I mean, foods that encourage obesity. So that kid will start storing very early. Kids are not moving around, and the body has sort of been trained to store. Then what are we witnessing? Kids who are obese right from their early infancy. They're obese. And you know, because we are not very aware about these things, we celebrate as mothers that my child is very healthy. And then the problem is now later on we are seeing kids already in their teens, they're having premature adolescence. They're having what we call precarious puberty coming in very early, and then they end up having early onset diabetes of the young. They have early onset hypertension. So we are seeing that the ages and the limits that we used to have, that most likely most people will start having this NCDs of cardiovascular interest by the time they're in their 40s. We're seeing it happening in their later teenage years, or even early teenagers, like 15. So that is where our problem is.
Are you clearly saying that we are seeing adolescents, or increase in cases of obesity and overweight among the adolescents because of the lifestyle? But do we have natural causes of obesity?
So people, and this one I tend to disagree with it. Though people say, and a lot of link has been said that, you know, there could be a genetic angle to it, you know, families that are big. Yeah. But from where I stand, there's that 20% that I can inherit a particular genetic predisposition. But when I'm aware of it, and my parents are aware of it, and my society is aware of it, they will make sure it doesn't happen. Because it's not cast in stone. You have a genetic predisposition to obesity. Maybe your metabolism is low. Yes, but you need a second hit on it, which is the environmental factors, which we have up to 70% control on them, so that now someone is obese. So I think, yes, sometimes we find ourselves because of ignorance, and, you know, I mean, we need to excuse that to that people don't know, but just that health awareness and people being very aware and appreciating that if my family, my father was obese, he died from a heart attack, and I'm getting kids and I can see the traits from earlier on, I need to be a conscious mother to just make sure that my children are not feeding from fast foods, and they're outside playing and running and riding bikes if they can afford it. And then how do we deal with this culture where now if you've lost weight, you will be linked to maybe a kind of stress? That's a very interesting concept, that as a society we think that high achievement or high society in life is associated with obesity, which really you're just associating a particular social strata with disease, you know, in the actual sense. My producer is saying kitambi ni udosi. Really, it's disease in the actual sense. I think it's just creating more awareness, public sensitization, so that they understand. Earlier on, you were talking about obesity and saying, what is the definition of the same? Considering African genetic and physical makeup now, we have strong data that has shown us that really using BMI for African doesn't work. Like for me, I'm quite tall, and I assume that I have strong bones, which I do actually. Like the minimum weight I can attain, even when I've lost so much weight, is arranged that if you put it on that scale of calculating BMI, will still be overweight. But really at that point, that's when now as scientists we had to ask those hard questions, and we came to understand that really it's not the size of your body per se. Obesity is the distribution of fat on your body. Where is it distributed? Okay, so you'll see that now we tend to use more of your mid-arm, upper arm circumference. We use your waist to hip ratio, which means the smaller the waist, the less fat accumulation around your tummy, so you're likely not obese. Because African, trust you me, the curves are amazing. We love our curves. And those curves, and science has also shown that when fat is deposited in the right places, it is more brown fat and not white fat. Because even that really determines what kind of, are you obese or not? So when people have waist around, fat around the right places, and they have no tummy, kitambi, you know, as we call it here in Kenya, like kitambi ni udosi. Kitambi ni udosi is actually remedy for insulin resistance, remedy for increased blood pressure, and in science we call it metabolic syndrome. So bad insulin, hormonal dysregulation, high blood pressure, kidney disease checks in, diabetes checks in, and that's where the problem is. So really, all of us should stand in the mirror, look straight to it, and ask yourself, where is my fat distributed? Fat distribution, very important to check. It's not about the size of the body. So how do I know that I am obese? So we now do check often what is someone's waist to hip ratio. So as a rule of thumb, if your waist as a man is about 90 centimeters, you're obese. Waist. And we know how to calculate the waist is between, I mean, it's nice for people to check up, you know, so there's a place where your waist is. Your waist can be up here. It's just right up something we call the superior iliac spine. It's just at the bone that it's behind you. So you go around the circumference. So for women above 80 centimeters, the waist, the width of your waist is too big. So just being very conscious so that even when you're putting on weight, let's assume that this kitambi niudosi analogy was working. That kitambi and that fat should be in different places and not where the tummy is big. So the bigger your tummy, the more risk you have cardiovascular wise, and the more risk you have to other things like ranging from gallstone to some particular cancers, and the risk you have of having respiratory illnesses, including asthma and having some form of lung disease where your lungs can't expand so well. And I think as a society, we also need to move away from really the stigma. And that's why I think people tend to just say, my family is like that. That's really social stigma.
Yeah.
So if we are able to move away from that stigma and understand that this is a disease that can be taken care of. And that's why from the cardiology side and even from our association, Kenya Cardiac Society, we want to really move very aggressively towards preventive of cardiovascular diseases. And it includes legislation that I think later on you'll bring in that angle for really what can we do to make sure that we curb obesity, and particularly in our children. Yes.
So is it right to say that majority of cases of obese are caused by unhealthy eating? Because there are some cases where people, some medication make people become obese or overweight, so to speak. Yeah.
Yes, that's a very interesting observation you bring there, that some medication, there's some medications that make people put on weight, right from insulin that is used for diabetics, you know, and steroid therapy that makes really abnormal fat deposition. People have humps on the back, and they have fat away from their arms and going to the wrong places. Some use of some retroviral disease medication that can make fat go to the wrong places and accumulate around here and really around different places in the body, which is not correct because that's abnormal fat distribution. So when you're obese, and that's why I'm saying it's a disease, you need to sit down with your doctor and really understand what is the cause. So that if you're going to boil down to what we call that this is really lifestyle, which of note is that up to 50% of the time it's really lifestyle. Then there's a small angle you bring in for the genes that maybe you're big people, but you put in lifestyle and that's your second environmental hit. And now you really balloon up, and then you realize also people are not doing a lot of physical activity. So physical inactivity. So it's like just saying that you're a car that is fuel and doesn't use the fuel. So really what does the fuel, even when you eat as simple as you eat ugali, if it's not used, the end storage is fat, and it will be deposited at the wrong places. We need to understand that physiologically the body is able to convert substrates or things that it's given into storage, and the storage is normally fat.
Oh, wow. Someone will say that for people who've really gained weight over, gaining weight for me especially is very fast, and losing it takes me a whole so much time before I could even lose a kilo of my weight. But now, so for people who are already overweight and they're struggling, they're saying, I cannot get back to where maybe doctors are advising. Is it just giving up, or how best can we reverse this excess fat and do away with? Is it just physical exercise and what you're eating and staying disciplined, or it can be reversible?
So maybe just understanding that obesity, as you said, always has a cause, okay? And we said majority of the time, 50%, it's lifestyle. But also making sure that we rule out medications, which you talked about earlier, other medical conditions like diabetes, thyroid diseases, some particular endocrine issues that can actually make someone, like there's a particular one for growth hormone, which can make people appear very differently. All those things. So you have to have a good assessment done. And then after that, now you can embark on a journey. And then now someone will ask, from your lifestyle, including the type of how your diet is. I think nutritionists like to bring this up, and it's very important that how does your diet, your typical diet in your social, cultural setup, what does it look like? And what can we do to improve that diet to make sure that your body metabolism, and you brought it really correctly, that metabolisms are different. There are people who their metabolism is so different, food moves from the mouth to the end of that path in just a day, and every day they go for a long call, you know, and the absorption is very different. How food is stored is very different. How storage is done in terms of distribution of where the fat will be is very different. So something has to be tailor-made to a patient. And as we said, obesity is a disease. It's not, you should not just label it, because maybe someone just eats a piece of meat and ugali and they put on weight so drastically. And someone else eats and eats, as people say, like, it's so unfair. Someone is eating so much and they don't put on weight, because people are really different. We are not like all cast in one, we can't be put under one blanket. But really comprehending that and understanding that as a person, you need to be aware about your weight. You need to see where you're starting from. A lot of us women put on weight, accelerated weight, when we're in the childbearing place, pregnancy, and then afterwards we don't lose that weight. So it's nice to really collaborate with your doctor and understand what are your targets. What I typically do with my patients is we first look at your risk. And we say that maybe your BMI is hard, but let's just measure your waist and your hip ratio. Let's look at your upper arm circumference. So we are starting from here. You have all these other risks. This is how you eat. So kick out the type of oil you're using. Let's change how your plate looks like, okay? Kick out the excessive alcohol consumption that makes people add weight and they don't know, okay? Kick out the smoking, because smoking, yes, they say people who smoke tend to lose weight, but really it makes people hungry all the time, and fat will tend to be distributed in the wrong place. So, though really scientifically they say a lot of people used to smoke a while back to say that it will help them lose weight, because they tend not to put on a lot of weight. But all those habits, you know, right from what are you junking on, what is your can you get out and walk? Can you take up the stairs instead of the lift? Can you just try and make sure that your children are getting out, take a walk, and all those things. So we tailor-make, and I like it when people put up targets. Targets have to be realistic. Let's not be conned by this marketing gimmicks that are out there that you will lose weight in 2 weeks. That is not true. So it has to be a progressive, slow, sustainable, feasible plan that involves you and your healthcare provider agreeing on the destination, and you start the journey one step at a time and understanding the challenges of everyone.
Overweight or obese, obesity is a disease, you've said, but there's so many conditions that are linked to obesity and overweight because it's anyway lifestyle related. You've mentioned high blood pressure and other non-communicable diseases. Maybe we can get to talk about the complications that are as a result of overweight. If you don't control your overweight, then what could go wrong with you as a person, your body, your health?
Okay. So the commonest are the two you've mentioned, but there is diabetes. And you know, diabetes and blood pressure comes with all the other complications. Your cardiovascular risk is higher, so your risk of stroke and heart attack is higher. Your risk of kidney disease is higher. Your risk of having respiratory illnesses ranging from asthma and to constrictive lung disease, restrictive lung disease, all those, they all come together. But also remember there are cancers that are really linked to obesity, starting from stomach cancer, most of the other cancers that are involving the abdominal area, like cancer of the gallbladder and all those, they're associated with obesity. And so many other things, including joint issues, osteoarthritis. So people, you can't walk. Then it becomes a vicious cycle of the joints are hurting, so you can't move, so you continue putting on more weight. And unfortunately, there's this one thing that people don't know much about, that obesity begets obesity. So if you're obese, you're likely to just continue putting on more weight if you really don't put a stop to it, And in this case, not really you putting, we are stigmatizing, like having a medical intervention to stop it. So remember that there's overweight, there's obesity, and there's moribund obesity, which is now all the weight above, the BMI above 40, which really these people can beg, they can't even move. But what do obese people suffer from when they are asleep? Did you know that they snore? Most of them snore. And snoring is culture media. It's like cooking up blood pressure. And it's cooking up stress hormones that are released by the body to make the body continue putting on more weight. So you find that...
But snoring is not normal.
No, it's not in an excessive way. No, it's not. Okay. Particularly when someone is big. It means at that point the body is not getting enough oxygen. The lungs, the airway is trying to open up. So they are ending up with lack of oxygen, what we call hypoxia at night. It triggers stress hormones. Stress hormones come in and make the body put on more weight because those hormones are cortisol and all those hormones that increase insulin resistance, and someone becomes diabetes, and it just becomes a vicious cycle. That's why I'm calling it obesity begets obesity. So it just continues round and round, and unfortunately, obese people are depressed. When you're depressed, most of the time, you eat more.
Yeah.
So you continue putting on weight. If you're married and you're obese, and you also have the mental health issues, that illnesses that come with it, you're likely to have problems with your spouse. You are likely to have erectile dysfunction or lack of interest on intimacy. Then your marriage is in the rocks. So what does that do to you? Continues to put a lot of mental illness pressure on you. So you continue the vicious cycle. So it doesn't come to an end, and I think that's why really we need to do a lot of awareness and public sensitization to understand that this is a disease, just like blood pressure and diabetes, that needs to be treated, because it just doesn't involve an individual. It involves a family. It involves a community.
So how do we break the cycle? Maybe you can leave us with the tips.
So I think the best way to really look at it is to just realize that this is not an individual illness, it's a societal illness. We need to break the stigma, embrace our brothers and sisters who are going through it, make sure that our children don't fall into that cycle, and use a very team approach model into managing obesity in our society, ranging from the family setup, where as parents we need to take up responsibility to make sure that our children are not falling into that illness. The other thing is just understanding if someone exists there, you need to support them. Then you move to the society, do the same thing, support the people who are there. But really at the top of it is a national approach, where we really need to put up legislation that controls marketing of products that promote obesity, legislation to make sure that our infrastructure, including schools, supermarkets, and roads, they're really supportive. And in this case, even residential areas have places where our children can play. Schools can be put up, and you can't run a school if you don't have a playground for children, you know? And all those things that our children, that is where we need to really, really, really concentrate, because this is what we call, this is our future. But if our future is already falling into this illness, then we won't have a future as a nation.
Yeah, thank you so much, Dr. Moraa. We appreciate your time. We're talking about obesity and some of the, harmful effects of being obese and overweight, and how best to control it. We highly appreciate your time here.
Thank you so much.
All right, that's where we bring the show to an end. Many thanks for keeping us company. I'm Purity Musea. Do enjoy the rest of our programming, and God bless.